So when we got there, I didn't know a lot about the program. Here I did all the research, and I thought it was okay. The kid's going in here, he's going to get fixed. I didn't know anything about the disease. Me and I, at that point, were falling out. I resented him, he resented me because of what was going on. But about 4 months into the program, I realized, okay, I work for myself here. I didn't understand it until they educated me. There's not enough education on addiction. People think it's something that, fall into and become a choice and just do it. It's not like that.
So it was a few words from today's guest, Tony. Tony is a father of somebody with SUD. Him and his entire family, including, of course, his son, sought out treatment at AARC, the Alberta Adolescent Recovery Centre. What an amazing experience. I hope you stick around for this one. Our show focusing so much on the family members of people who suffer with SUD. Typically, we get moms, right? So it was a real treat to have a father on it, just to get that different perspective, if you will. And listen, the title sponsor for today's episode is FAR. That's Families for Addiction Recovery. They focus on the families of people who suffer with SUD, and they offer a bunch of free services to family members of people who suffer with SUD, including 4 group meetings a month. They offer a peer-to-peer support system. It's one-on-one, absolutely wonderful work that they're doing with that. And of course, if you need some real-time support, you can speak to Sydney, who answers the phone during their business hours there, who's just one of my favorite human beings. So check them out, guys. You can learn more about them at farcanada.org. And in the meantime, I hope you really enjoy this episode. Thanks. Hello, everybody. Watchers, listeners, supporters of all kinds. Welcome to another episode of the Ashes to Awesome podcast. I'm your host, Chuck LaFlange, checking in from Krabi, Thailand. Halfway around the world in Calgary, Alberta, is my beautiful co-host, Dr. Lisa. How are you doing today, Lisa?
I'm very good. Very good. Happy to be here.
Happy to have you back on. And I'm still kind of on this hangover from not having you around for 3 weeks, where it's just oh yeah. So I'm quite happy that you're back to, things are back to normal around here. Our next guest is our returning guest from one of our partner organizations at AARC, that's the Alberta Adolescent Recovery Centre. Kiera, how are you doing today, Kiera?
Great, thanks, Chris. Glad to be here too.
Good stuff. I got the name right the first time. If you notice this, I've got every time since pre-record too, I've got the name right. So gold star, my chart, just saying. Our final guest for today, of course, is Tony. Tony is a father of a graduate, and of course, the AARC program being what it is, a graduate himself of the AARC program. How are you doing today, Tony?
Good, Chris. Thanks for having me on.
Thank you for coming on. As we were just discussing before I hit the record button, we have a lack of fathers that come on the show, and I think that's something that I need to work on. I end up just speaking to more mothers, and there's so many more fathers that have something to say. So I'm really glad that you're here to share some of your thoughts and your journey, what pieces of it that you'd like to talk about. It goes a long ways to everything. Before we get into that, though, I just do want to acknowledge that today is Overdose Awareness Day. Shit, I didn't see that coming. Not at all. We've done a bunch of memorial episodes. I've spoken to so many parents, so many siblings, loved ones in general, people that we've lost. And I think it's really important to acknowledge the people that we've lost and the effects that's had on so many families all around the world, in Canada, North America, literally hundreds of thousands in the last few years. Right. So this is a real problem. It's something that needs to be addressed. And we'll just do our little part here today in addressing that. So just wanted to make mention of that. I didn't see that. That was a record, Lisa. Did you see that?
I know. I didn't see that one coming that quick either.
Not at all.
That's
I've
okay.
never cried that early in an episode. Holy. Not that it's a funny thing. So anyway, let's move past that now, just so that I can function for the rest of this. Tony, so you're the dad. I'm going to let you kind of share your journey, and we'll ask you some questions as you go along, if you're okay with that, and share what parts of it you're willing to share, because I know, whatever, for obvious reasons, there's things that people don't want to talk about and want to talk about, right? So could you kind of take it away?
Yeah.
Right.
Well, it's been national awareness as well. We're lucky where our kid is, overdosed a couple of times, and we're the lucky ones. Still with us here, and he's in recovery now, a couple of years. Yeah, a year and 10 months now. He's sober, clean.
Oh,
so
yeah.
We're extremely lucky.
Can I ask what his date is?
He's a year and 10 months now, clean.
So, well, I asked because I'm a year and 10 months. October 21st is my is my anniversary.
It's October sometime. Yeah, I don't know the
Yeah,
specific
okay,
date.
okay. So
but-
very close to my own journey then. Okay. I never realized that before now. So, okay. Yeah, please continue.
Yeah, we're just so lucky to have found a program that we could intervene ourselves with and have them, but we were at the death's door a couple of times. We're just very
Kidding.
fortunate to have found AARC.
No kidding, eh? No kidding. How I'm trying to be sensitive to what we talk about, what we don't talk about here. So I guess, can you tell us a little bit of what your relationship was like when things got bad, but more importantly, much more importantly, where things have gone since recovery? Like, how's that changed the family dynamic, specifically your dynamic with him, and to go from there?
Yeah, as growing up as a kid, it was great. He used to be into sports, he was enthusiastic. And then as things went by, he started to lose grades in school, wasn't so interested in basketball anymore. Kind of made me frustrated. I didn't know what was going on. Then when he got in trouble in school, we realized there was things going on. And I tried to, as a parent, control it and help it, but I wasn't able to. And that's where I got very frustrated with myself.
Can I ask,
couldn't help
when you say tried to control it, can you tell me how?
But try to guide him in all the right directions, trying to encourage him, trying to motivate him, bring him to sports, bring him to different activities, support him in every way I could. But it just wasn't sinking.
I can only imagine how frustrating that must be.
Yeah.
Can I ask Tony, like in hindsight, how old was your child when you think now maybe the struggle started?
Hey, just a quick interruption for the all too important PSA. Today's PSA is brought to you by Yatra Center here in Krabi, Thailand, where I reside. For those of you that are new to the platform, I started my healing journey at Yatra when I came to Thailand. I was lucky enough to experience a residential treatment program. They treat addiction through the lens of trauma, and they do it very well. Absolutely one-of-a-kind program that they got going on there. And you might be surprised if you look at the cost relative to other private pay options in the rest of the world. So take a look at them. You can learn more about them and also see a bunch of episodes that Mike Miller, the head clinician there, has been on here on the podcast. If you go to a2apodcast.com/trauma, and here's your PSA with Chad Valyear.
Hey, what's up? This is Chad from the Valyear Show. I don't carry a bag around that doesn't have at least one of these or one of these in it. And I carry them because people are dying and dead addicts can't recover. So I don't care how you're finding recovery. I don't care what fellowship you belong to. I don't care if you're using harm reduction. Let's take death out of the equation. Let's stop people from dying. More love, less judge. Peace.
Like what grade?
High school. Yeah, when you started high school, that's when things started to go down.
Yeah.
So.
And where do you think? Sorry, Chris. Where do you think that it came into the picture? So, for example, in my case, I have a sibling who suffers with substance use disorder and also started in adolescence. And in his case, we have a strong family history of a lot of substance use disorder, not in our immediate family, but in, grandparents, probably mostly. And then, had I think, a pretty good early childhood, but then started partying with his hockey team. And of course, most of them walked away from it one day, and he did not. But in your case, like, where did it kind of come onto the scene?
Well, he says it started before high school, which is an episode with him that I've yet to discuss, because we're still in the early stages of recovery. So I know it wasn't our immediate families as myself and my wife, because our parents didn't drink. So we couldn't understand where it came from until we started thinking about it, I guess. In my own head, I was thinking about the uncles and then learning about the disease that it might have skipped a generation. But he started in high school experimenting, and that's where it went downhill from him. But he couldn't stop like the other players on the team. He just kept going.
Yeah, so very
So it
similar
started out with friends, though. Like initially, he wasn't doing things alone. He was doing stuff with his buddies or whatever.
Yeah. And then he ended up doing it alone. Yeah, and then finding things in the bedroom, behind the couch, in the bonus room, stuff like that. Yeah.
So do you go back, and this is probably something that parents can relate to, so that's why I ask, and I mean, you said it with the benefit of hindsight. Your understanding of it then compared to your understanding of it now as to when things kind of started to go off the rails. Go back and go, like, now that you've learned so much about the disease and you've had a chance to de-escalate yourself, I guess, or you know what I mean, to kind of regulate things and go, oh, I guess, yeah, there was that and there was that. Like, does the time frame change with the benefit of some knowledge and some hindsight?
100%. Yeah. After going through treatment myself with him on the journey, I learned a lot about myself and about the disease and how I needed to change my approach to it too, and have an understanding and be more compassionate.
So I guess the follow-up to that question then would be, Tony, for a parent that's listening right now, is there anything that you can say, I wish I would have caught that specific thing, and maybe that would have changed the trajectory? What ifs are a horrible thing to dwell on, but with the benefit of some knowledge and some hindsight, is there anything that you would say to a parent, hey, watch for this thing or watch for that thing, right?
Well, yeah, I'd say watch out for the grades, watch out for dropping out of social activities and sports, and disconnecting with the real good friends and starting to mix with the guys that are party animals.
Fair enough.
Mm-hmm.
And then, if I can just comment on that as well, I think I think we're touching on like a big issue here, because line between experimentation and dependency is as a parent just would not have recognized that line at all. It's such a huge gray area, and I think the way things are now, there is so much experimentation going on, and in even at junior high age and sometimes before. And yes, there's like a level of denial as a parent about like, how concerned should I be, or is this just the norm? Like, it's so easy to normalize it because it's mm-hmm. just, I don't know, it was completely new territory for us as parents. And like, when do we freak out, and when do we like Fair when enough. Do we just Fair kind enough. Of try and have those compassionate conversations and try and support, and I think we had conversations then when we went into AARC that educated us a little bit more on that piece, because I don't know how many parents are set up for that, for being thrown into that situation, right?
Yeah.
Can you share, Ciara, like some of what AARC, like what education is provided around that? Like, how do they help parents decipher whether this is experimentation or whether this is, alarm bells going before the big crash?
I think, and I'll just talk about my parent experience there, because again, talking about like all those clinical pieces behind the assessment process is not something I like to step into, but for me, that became acutely aware when I was going through the intake process, like with the pre-assessment coordinator, and she spends a lot of time with the parents, asking all of those difficult questions and really deciphering whether, the client is, or the youth is, a good fit for AARC at that time, but also asking the questions, to really get a bigger picture. The information that she gathers then will be passed to a clinical director, either Donnie or Kelly, and at that point, should they fit criteria for moving forward with the formal assessment. Basically, that is saying, okay, yes, now you're looking at dependency and treatment is what's needed.
I think what's really challenging, and maybe both of you as parents can relate to this, but I obviously can understand how you can sit down with somebody and assess and ascertain if today they're struggling with addiction, right? Like, I can do that. The hard part is when your kid's experimenting, unless you have a crystal ball, you don't know where you're headed. And that's the terrifying thing. If you find out your kid smoking a bit of weed or, doing whatever they're doing, you really have no way. I mean, yes, you can look at your family genetics and, yes, you can ask yourself, has my child suffered trauma? Because these things are going to increase the risk that they will evolve into struggling with addiction. But at the end of the day, it's kind of like a hindsight is 2020 sort of scenario, because when you've got a kid who's smoking some pot, you don't know if pot is going to lead to cocaine, is going to lead to crack, is going to lead to meth, or if your kid's going to smoke a bit of pot and then a year from now be like, you know what, that makes me feel gross. I'm not doing that anymore. So it's easy to tell that, okay, this kid is now struggling with addiction and they need a program like AARC. But in the early days, it's not so easy to tell which way you're going.
Yeah, because nobody knows. Are they going to have an off switch or are they not? And you don't know until you're deep in there. And, just to relate to something that Tony said earlier, like that's what they say at AARC. It's fun, then it's fun with problems, and then it's just problems. And it's when you're dealing with just the problems, is when you're really reaching out for treatment and just like, what the heck do we do now?
Mm-hmm.
I didn't think of it that well. I thought of it that way, but I also gave a little bit of leniency to him as well, because we moved country as well, so that I thought he might be experimenting a bit and fitting in with his new peers. So I gave a little bit too much leniency in a sense, and not having that awareness about the whole disease, and then rapidly took over.
Lisa said that perfectly, though. Without a crystal ball, what is, right? I mean, you can go back and say that to yourself now, but in the moment, geez, what a hard thing to navigate. What an unbelievably hard thing to navigate.
And it's sort of similar in my family's scenario, like my parents became aware that my brother was partying a bit, drinking a bit, doing some weed. And they knew, and they again sort of thought, well, a lot of kids are doing this, and they wanted him to have a safe space. They didn't want to be so confrontational that he would go to a party and then not want to come home. Right? It's like they wanted him to continue to come home. They thought, well, if we're not too hard on him, then he's more likely to be honest with us. And, so like the reasoning behind it makes tons of sense. And again, if he was somebody who wasn't, I believe, completely wired to end up on the path to addiction, maybe that would have worked out really well for them. But there was definitely the same thing. Like I don't put words in my parents' mouth, but I think they would very much relate to that, that you're trying to understand, well, why are they doing it? How much should I freak out? And, in hindsight, you go, gosh, like if only we had known, then could we have altered the trajectory? But
yeah, there's also that part where, like you're saying, Lisa, you give them that bit of leniency. You're worried, but you don't want to destroy a great relationship that you have with them in the early stages by being that control freak, right? But then when they get deep into it, you do become that control freak. And that's what happened with me, my experience. And then it damaged the relationship because I was too controlling.
Yeah.
And then you blame yourself, thinking, did I push him too far? Is he doing this now because of me?
So it's a no-win situation, right? And to aggravate that, the fact that it's all so unique, right? Each kid is unique, each parent is unique, their relationships are unique, and so to say, this is what you should do. Who knows what you should do? And for parents, I mean, I can't imagine. I can't imagine having to figure that out or trying to figure that out. I just can't. Lisa, you've said it in a few episodes in the past, and I think it's very relevant right now. That story about how you had spoken to your ex-boyfriend about the difference between your brother and other kids. I'm going to get you to kind of repeat that now because I think it's very relevant. And, we've got a whole bunch of different new people listening right now. So if you could kind of tell that real quick, if you don't mind.
Yeah. I think I know the one you're talking about, but
of course you do. It's like my favorite Lisa quote. Of course you do.
Okay. So I, when my brother was going through his journey, I was dating a guy at the time, and he meant well. Like I think he truly inherently wanted to be compassionate and wanted to understand. And we had conversations around the topic of choice. Was this my brother's choosing? Did he make choices that resulted in this? And the interesting thing that worked out well for me was that in this particular situation, this was a guy who had partied when he was young. We were in our late 20s at the time. But when he was in his early 20s, he was somebody who had partied, he had done ecstasy, he had done cocaine, and again, like at a party level, like he'd be at parties and he would do this stuff. And I remember saying to him one day, I said, like, what my brother did and what you did are actually no different. My brother did the same thing. He went to the parties, he partied with his buddies, he, thought he would do some drugs at a party. The difference came down to the fact that, again, from a genetic perspective, I think my brother was wired to develop an addiction. And it's kind of like playing Russian roulette, and when you're young, you don't know, when you pull the trigger, you don't know what you're going to get. But I think that was something that really resonated for him, because he was able to say, you're right. Like, I actually did the exact same stuff your brother did. The difference was he was able to walk away, as the majority of people are. But it's like, you don't know when you're going to be that person who can't walk away,
Absolutely. So I can imagine, stereotypical thing. You're sitting there, you're having a neighborhood barbecue, or the neighbors over the barbecue, and you're talking about your kids, and they both did the same thing on Friday nights. But who knows? One kid goes this way and one kid goes the other way with that. So, yeah, second guessing yourself.
Yeah.
It's natural, but I don't think it's a fair thing to do to oneself either, because who knows, right?
But I also, the thing that came up from you and Tony said that he questions himself now is like, I have so many patients, Tony, who have nobody. They have nobody. Everybody has given up on them, walked away from them. I have patients, like I've had people in hospital with me for 6+ months where not one family member reaches out to ask, how are they? Are they okay? Can I support them? What's going on? I've even had families in situations where I've taken the initiative to reach out to the family going, where the hell are these people? And they're just like, yeah, no, I'm busy. Like, and I'll say, like, do you have questions? Is there any information you'd like? I've got consent to speak with you. And they're like, nope, don't need anything. I'm good. And so I've had the conversation with patients, and I've had the conversations with patients' families where, sure, maybe it's annoying. But if you've got a family member who is there and they're annoying you, you're one of the lucky ones.
Damn straight.
Yeah, you're right.
Straight.
Yeah.
Right.
Yeah. I don't think I even answered your initial question earlier, which is, very closely tied in with this as well, is that education piece. And you asked me earlier, I went down a side road, but you did ask about like how they introduce that education piece in AARC. And it's very important for that reason, because a lot of the families are shattered by the time they're coming into AARC. Like, there's a huge amount of blame and resentment on both sides, both from the kids themselves, from parents and siblings. Like, the resentment has built. You're talking about like, chemical dependency and kids that are willing to do anything to stay in their addiction. So along that journey, they do things that are not representative of their core personality. And we see that a lot at AARC. And so as parents, and from my recollection, the very first introduction that I had to learning a more being educated around addiction. So we are introduced to the 12 steps of AA based on the Al-Anon program. But as part of that, the very first thing I was given to read when I met our family counsellor in AARC was the doctor's opinion in the AA book. And it just, not that it just opened my eyes a little bit to perhaps looking at this, approaching this a little bit differently. And it opened a door where I was like, oh, just maybe this is something worth looking into. And from there, and just being with the families, obviously, like hearing their journeys and how many people had been on similar path and taking kids in the recovery home, and seeing the core of these kids made it really obvious to me that this was not a choice. And hearing the parent version, because you're in like a group therapy session with parents on a weekly basis, it was just quite eye-opening. Like, we we had all dealt with the journey in a way that nobody's proud walking into AARC. Like I think the journey as a parent, it does push you to some extremes of your personality. You say things you don't mean, you think things you never want to think about your kid. And that's why the family component of AARC is so important, because everybody needs to, first of all, be educated and second of all, heal together.
Thank you for bringing it back to AARC. Thank you. Because I want to ask you, Tony, we've had the benefit now of hearing from Kiara and another mother. And generally speaking, as I said earlier, we've had a lot of moms on the show, but a dad is a very rare thing. So with AARC, you get there and you get some education, like Kiara was just speaking to now. How does it change things for you? How does it change things for you in the way now that you, at the time anyway, does it de-escalate things for you? Does it tell us about how you feel walking into that and being supported in a way that I can only assume you would not have been outside of that program. I mean, in so many different ways, right? Can you speak to that?
Sure can. Yeah. When we went to AARC, it was very, very late. It was just the very last moments we were lucky to have found AARC. So when we got there, I didn't know a lot about the program. Here I did all the research. And I thought it was okay. My kid's going in here, he's going to get fixed. I didn't know anything about the disease. Me and I, at that point, were falling out. I resented him, he resented me because of what was going on. But about 4 months into the program, I realized, okay, I work with myself here. I didn't understand it until they educated me. There's not enough education on addiction. People think it's something that you fall into and become a choice and you just do it. It's not like that. That was a big learning for me. Now I have more compassion about it. So whenever me and I are together, we talk to each other. Now have more empathy, discuss things. If he's in the valley, I go in the valley with him. We try and climb the mountain then. And we resolve things. We make peace with ourselves.
That's amazing. It's amazing. So then, it's something in our last episode with you, with Kiara, when Donnie was on, and of course we spoke with us pre-record too, and that really hit hard on me when Donnie was speaking. That's Donnie Serink, if anybody's paying attention. 269, I think was the episode. Have I got that right? Yeah. About the difference in his family's life now for, his niece and nephew. So, you're getting into the next generation. And of course, the decades in between then and now that curbing this thing or catching this thing early has made, like, the difference it's made in their lives. So for you now, you're almost 2 years into it. So there's a question I asked you a while back that we all went on a tangent and I never did get you to answer, was what's like the difference in the relationship forever now between you guys? Like, how does that look? And I guess you did just kind of answer it now, but to me, it's such a profound thing that things are forever changed as a result, whether or not things go the way you want them to for the rest of his life. AARC has given you an opportunity to change things forever. And I think that's just amazing. So I'm not sure what the question is there. Lisa, I'll let you jump into some questions because I kind of went on a little bit of a tangent there, but I do that.
I guess one of the things that I would love to hear Tony talk a little bit about, and I don't know if it's something you've reflected on, you have insight on, or that you're comfortable to talk about, but you mentioned that you tried to control things. And I guess it stands out to me because, again, I see parallels in my family. And again, to stereotype, and that's what it is, but, stereotyping, and it fits in my family. My mom was the softer one, the more nurturing one, the one trying to have the conversations. And my dad was the one who was like, I'm going to fix this. I'm going to control this. So I'm just wondering, like, if you can share a bit about, if you've reflected on that and what you've kind of learned about, like, what was driving that for you, that need to try to control the situation.
Yeah, sure. When things started slipping in school with grades and stuff like that, I got on this case about, going to school, the importance of education, because in my background, it was always every father wants their son to be better than them. I wanted him to be better than me, and I could see it slipping. And I just wanted the best for him. So in that respect, I tried to coerce him into the way I would be thinking, But after learning I went through the 12 steps of AA as well in the program in AARC. Step one is the powerless over alcohol. What I learned about Al-Anon is that step one is basically mind your own business. You know, you can't be controlling them. That did more damage trying to give him that guideline. I think he went out and probably said, F you. You know, I'm doing this, and it just escalated from that. So I kind of blame myself in that respect a little bit.
Do you see that, like, the desire to control was probably driven by fear?
Oh, it was all by fear. Yeah, totally. Yeah.
Right? Because that's like, sorry, go ahead.
That fear then turns into anger as well. And then anger with yourself when it comes out to other people. It's not.
Yeah. And we've even spoken on the show, right, about, because I think it's pretty hard to be the loved one of somebody in an addiction and not experience anger, right?
That Jesus, I think, is the only person ever that could.
Right? And the thing is that anger is powerful, right? And we've spoken about this before. But like if I have a patient say to me, well, I'm angry, I'm like, okay, but how are you really? Because like anger is just the blanket on top of the real thing, right? But people will go to anger because anger feels powerful, right? If you think about your alternative, where I can sit in the corner and cry and feel scared, or I can put the blanket of anger on and stand up and scream and rah, you know, and it's like anger feels powerful. So people are far more comfortable to be angry than they are to sit in a vulnerable place of fear. And so it's pretty common. Yeah, I was going somewhere with that and I've lost my train of thought.
No, I
have something to say too. When you finish off what you were going to say, this is your question.
No, I get what you're saying, Lisa, 100%, because that anger, it's a sense of self-importance in a way to try and cope with it yourself, but it's not the right approach. Because when I went to AARC and I met the group of men that I know there that helped me get out of this rut that I was in, being vulnerable was what helped me a lot. Learning about the disease and then being able to cry about it and talk to men about it. Men don't talk enough about this stuff. That's what helped me. The vulnerability and the support.
And I can only guess, but you strike me as a type of man that previous to this, vulnerability was not one of your dominant characteristics. I can, right? I can only guess, right? So that shift there must have been profound for you. Is that has to be, I can only put words in your mouth, but that has to be a direct result of the peer-to-peer.
Sure is.
It has to be. Yeah.
It is. I couldn't become the man I am now without that group of men in AARC, without that community.
That's powerful.
To understand myself better, to understand people better, to understand the disease better, to be a better person, to help people. It's so much nicer than the anger. The humility is just beautiful.
We've spoken about this not that long ago, Lisa. 12 steps. Like, and for myself, had I not fallen into addiction and led that life and now I'll say recovery rather than 12 steps specifically, but 12 step is definitely the dominant, path to go. There is no way I would be taking the time and the effort to grow that out the way that I am now if I wasn't in recovery. I'd be another cog in the machine doing my thing and living my life. But you, for yourself, through 12 steps, through fellowship at AARC, through the group therapy, all those things, everything you just said now, I don't think there's any way, most people anyway, would ever be in a place where they'll say, like, learning to be a better man, even trying to be a better man, even thinking about trying to be a better man. It's just not something that most people do because they're just living their life. So if there's a silver lining to everything that you have gone through, I would say that might be it, right? And it's just working on yourself. Most people don't do that for, without some sort of cause to it anyway, right? So
I mean, that's why, I've said before that I feel like we should, and I've even joked about this with my brother. I'm like, I want to go to therapy. Like, I want to go to do a program. But I think substances or not, I think like what we could all gain out of doing a program like AA or, other ones too, but would be profound. And it's also why, like, I'll have colleagues or I'll have friends who are like, how can you enjoy working with people who struggle with addiction? And in part, I think people say that because it is such a beast. It's such a powerful beast, and we do not always win. And I think for some people, it's like it beats you down, and it can be overwhelming. But I have said it before, and I'm sure I've said it on the show. People that I know, particularly people who not necessarily are in active recovery, but who have been in recovery, who have worked recovery programs, are the most incredible human beings that I have ever met in my life. In terms of level of insight, in terms of seeing the world without judgment. They're wise, they're insightful, they're compassionate.
She's talking about me right now. I'm just saying. No, I'm just kidding. Sorry, I had to throw in a jackass moment there.
But do you know what I mean? And it's because of exactly what Tony's just alluding to. Like you do this work, you do these programs, and yeah, like I just don't think you can work a program like AA or Al-Anon and not come out of it a better person.
It's powerful. What going through the program, what really got me was the level of support from other men that were all professionals, all different walks of life. But I take it so seriously now because I remember talking to one gentleman. He called me, and I met him about 2 months later on because I'm open and as part of the community to discussing with other men. I met him about 2 months later after this phone call, and he said to me one day, and this is what changed me and makes me take it even more serious to help other people. When I met him face to face, he shook my hand. He says, and gave me a hug. He says, I'm alive today because of you. He wasn't an addict. He was a father. That was powerful for me. It drives me now.
Kidding.
Really?
Yeah. And I think just to, and this is absolutely about the dads today, but like when we're talking about that piece of, living through the Al-Anon program, and that's what the AARC community have built is any AARC event that that I attend or have attended in the past, no matter where you turn, there are people hugging. And visually it's just beautiful to see. But behind those hugs, like you say, Lisa, are people who are living now through the Al-Anon program or AA and have really learned to live with like integrity and humility and gratitude. There's a huge amount of gratitude. And, necessarily people who have come through AARC and things are better and their kids are living this wonderful life of success. I'm also talking about people who, whose kids are still struggling, perhaps back out or passed away, or like it's really, I think the AARC program provides people with like a new set of tools to navigate this journey. We were talking about earlier, everybody who walks through the doors of AARC is driven by fear. Yes, some of that looks like anger. For me, I really ramped up that part, like, oh, if we just love them enough, like if we just keep going with this compassionate approach. And it just became like, obsessive might be a little bit extreme, but it was just like, he's got to know he's loved no matter what. And it was hard. That piece of the journey is it's just so emotionally charged that it's becomes exhausting, and it's an awful feeling to have resentment around that piece, because it's like, no, I mean that's a message of a parent, is that you love them no matter what. But it's it's a tough journey. But then to be connected with this community of parents who are also driven by fear and are dealing with it in many different ways. I'm not saying it's black and white either. It's anger or it's compassion. There are lots of different ways that this presents, because people are just like, nobody's prepared for that journey. So it's hard to know what way it's going to go.
I don't know if either of you could comment on this, or both of you want to comment on it. But another thing I think that's interesting for families is that oftentimes the mums and the dads have very different ideas about how to approach the situation. And I've seen it cause conflict between mums and dads. But, did you guys have the experience of feeling supported by the other, or how did that, what was that like for you?
On different pages, for sure. Yeah. I was more like, I don't want to over escalate the word of controlling, but I was more into that side of it. Kira had a lot of compassion. I didn't see the compassionate part. I was like, what the hell's going on, my kid? Not understanding. But yeah, totally, you're right. 2 different pages. And I think a lot of couples probably go through that.
Yeah, and I saw that in my parents too, like very different.
Yeah, you spoke of that quite a bit, Lisa, right? The different,
even,
and the frustrating
things about,
part that comes from that.
Things about money, like the phone call for money, and one wanting to there was never, very, very quickly it got to the realization that you don't hand over cash, but it was like, order groceries and have them delivered, or pay for a night for somewhere warm to sleep, or those kinds of things. And then, I had one parent who felt that was a good thing to do, and then I had another parent who said, but if we don't do that, will that get them to a place of desperation that will get them to a place of asking for help? And and again, and both of them, I think, realizing that neither of them knew what the right answer was, and so just having those different opinions, knowing that there is no answer. It's not like, okay, we don't agree, let's call the person who knows. It's like, because no one knows.
Yeah, and I totally agreed. And I think, it's impossible to parent through this journey without tension in your relationship, because there is no right answer. Like, whether it's anger, whether it's over compassionate, like it's just that there's no logic when you're parenting that journey. So for obvious reasons, it does cause tension, and sometimes a lot.
And then you have the family dynamics where you have, other children that are seeing a different side to that. Why is that changing here? And that's powerful when you reflect on it. What damage have I done there?
SUD, it's a nuclear bomb. It really is, right? It just everything around it.
Tony, did you now find
go ahead.
As a parent, and this is not so much just as a dad, but as a parent, like, did you ever feel that you were so focused on your child who was struggling that you weren't focusing on your other kids?
Yeah, the attention was taken off them. Yeah, and that hurt.
Yeah.
I did find that.
Do you find yourself? Go ahead. Sorry, I'll let you finish.
But it's too late when you reflect. Until you go through treatment and you do your step work, you do your 4, you do your 5, and then you realize how many people have I affected by my reactions to everything. And take a good look at yourself and then try to change.
Yeah, that makes the family component of AARC difficult for a lot of parents, because, it's different than other programs in that way that, parents do have to look at their part of the journey. And, we know, we're also educated that, we didn't cause it, we can't cure it, you can't control it. Like, that's a very big part of every parent conversation in AARC. But also look at your part. That is very, very difficult. That's why, sometimes families are not willing to do that, and, can sabotage the journey of the youth. But it's definitely a big piece of what has to happen in order to support in a different way post-treatment.
I think that's the most amazing thing about AARC, is that the whole family, it has to happen for everybody to move forward and to do better. Weird curiosity here, Tony. We're sitting here with Lisa, who's a sibling and whose work quite often revolves around addiction. Kara, obviously your work revolves around addiction. Tony, in your professional life, are you open about your journey, or is it something that you kind of keep close to the chest, as a lot of people do? And if you are open about it, do you find yourself wanted to be there for when other people might be experiencing similar things? Because we're in a day and age where some of your coworkers are going through exactly what you've gone through, right? Because the odds being what they are. I mean, the epidemic.
I am. I have an open mind now going into work. When I'm talking to the crew, I'm thinking about, okay, I've got stuff going on. These guys must have stuff going on. We all have stuff going on. And I do talk about it. I go into work sometimes wearing my AARC t-shirt. One guy said to me one day, I was at the dog program. And I said, no, it's Alberta Adolescent Recovery Centre, to help teenage youth that are struggling with substance abuse. And then he opened up about his mother. His mother passed away since, but he's 17, this guy. He's a young lad. He's an apprentice. And he was talking about everything. He just opened up, and it's to spread that word, and then for him to come back out feeling so good about it, being able to talk, because he wouldn't have normally talked, because there's not many people that approach this subject.
I have to say, the more I listen to you talk, Tony, on both pre-recorded now, the more I admire you.
Thank you.
I do. Yeah. I think what you've done and what you've gone through and what you're doing is absolutely amazing. For men, it's just so much less common to be open and vulnerable about things like that. And I think it's important. It's hugely important for you to be setting an example like that, especially with younger people.
Yeah,
hats off to you for that.
Not just with younger people. People know my story. And I've always said, approach me if you need to. I'll help you. It helps me out too. It's a two-way street.
Yeah. Service. It's one of the we mentioned earlier, it's one of the fundamentals to a 12-step program is to be of service. And from the sounds of it, you're most certainly doing that.
That's right.
So,
it makes me think, and for some, there's always these moments that stick with us, right? Like something somebody has said to us or whatever. And I remember years ago, I was at work. I was actually in the Emerge doing psych consults. And a nurse there who knew about my brother's situation was like, hey, how's your brother doing? And then there was another nurse in the room who didn't know this and so was overhearing this conversation. And I don't remember her exact words, but she actually asked me, she's like, are you not embarrassed to talk about this? And it just, Tony, hearing you say, no, this is the, this is not AARC, the dog place, this is a recovery program. I feel like the more that we are open and the more that we talk about this freely without shame, the more that we beat that down, and I mean, luckily I was able to look at her and be like, why would I be embarrassed to talk about this? That's the most ridiculous question I've ever heard. There's nothing to be embarrassed about, But again, I mean, this was like a health professional working in an emergency department in Psych Emerge, not just Emerge, but Psych Emerge, and it's just so I just love that everywhere. I work in a hospital where I probably see more of it, but it's everywhere we are. I feel like the more people can be open and share and talk about it and normalize it, the more and more people will be comfortable to share their stories, to reach out, to ask for help.
And the easier it becomes to ask for treatment. And what do I do now?
Yeah.
Yes. Having
absolutely.
Well, and we know with your journey, Cara, getting to a place where you even knew about a place like AARC was a long, horrific, if I can use such a word. It's a process to get to that point, right? I mean, you'd spoken openly about your story in the past, but even getting to that point, and 20 years as well, it just shouldn't be that hard. It shouldn't be that hard to hear about something like AARC, right? It shouldn't be. It doesn't need to be the last house on the block, and I think if we can keep trying to change that.
Yeah, and I think sorry, Chris, that analogy Lisa just provided there is exactly why these platforms are important, is that if somebody is asking for help, there should not be a barrier. There is, let's just make things very black and white here. AARC is around for 32 years. It's research backed. There's been many research projects done on AARC, but yet there are families on this journey, and the majority of them, I mean, we were at that International Overdose Awareness Day event yesterday, and there were so many people that I spoke to yesterday from different organizations who are already connected with many, many families on this journey who hadn't heard of us. That's the importance of having a booth and raising awareness, and having parents at a booth who have been on that journey, know what it's like to have access treatment at different levels and still find themselves in the cycle. And it just feels off to me that there is like research-backed treatment established over 30 years ago. That should be out there in the community. It should not be a journey to access treatment at that level. If you need it, it should be handed to you on a silver platter. And that's why we do this. Yeah.
Totally.
I don't think anybody has an understanding unless they go through it. For men, we're meant to be the alpha of the family. That's our mindset, so to speak. Protect, provide, fix, But us men too, it's okay not to be okay. I have my ups and downs still, but I know how to get through it. I know who to talk to. I know who my people are. And that's what we need to spread that awareness about. The support is out there, not just for the siblings, not just for the children of the family that are suffering from substance abuse. It's about your own well-being too. Like, it's torture as a parent unless you understand it or connect.
And Tony, do you feel like there's something you could share in terms of, have you gotten to a place where you're able to show yourself some grace, about all the clarity that comes with hindsight, the fact that, again, there is probably still ingrained in you this idea that you're the alpha male who's supposed to be protecting your kid, and, and your kid ended up in a terrible situation. What have you learned that's kind of enabled you to offer yourself some grace?
It's a work in progress. It's one day at a time, Lisa. How can I put this in words? It's not easy. I'm not saying I'm 100%. My life's perfect now. It has its ups and downs, but I got to work on myself. I had to change myself, my views while I went through AARC. And that was the whole understanding and the concept of the 12 steps. That's what carries me through, because I still do my work every morning. I read my book, do my things, just to get through and see what's up for the day. We're just going to live today as today. Anything can happen tomorrow. You don't want to go there. You don't want to think about yesterday. You're just living in the moment from now on. It's a totally different approach to how you view your life and how you view others. When you wake up in the morning, you go to work and you say to yourself, okay, I'm going to talk to people, but they have a lot of stuff going on too. So you take a different approach in the way you talk to people.
Kidding, eh? No kidding.
Yeah.
As we get to the top of the hour, one or two more questions I want to ask you here. Tony, your experience being what it is, in having certainly a different lens to look at things than a lot of people do, and a lot of that being due to some of the success of the program at AARC. Are there any additional resources or systems that you wish had been available and that are becoming available or are available now to parents that are in similar circumstance?
I wish the awareness was out there about addiction. It's got to be, the word has to be spread, and it's platforms like yours, Chris, that help this, and we got to get it out there more. Thank you for what you do.
Absolutely. Right. As far as your son now, what are your hopes, dreams for him?
Well, expectations used to be a lot of things, but they're not so much anymore. I just hope that he has a comfortable, good life, and wish him the best and support him in any way I can.
Yeah.
Just give him all my support. That's it. Love.
Kidding, eh? No kidding. Before we get into daily gratitudes, Lisa, is there anything you want to offer? Anything you have to say or ask?
Just when Tony said that, I think when you go through this kind of journey where you literally fear that you are going to lose that person, what matters becomes real clear, and suddenly it's not, oh, well, I hope they do this degree or that degree, or I hope that they, make this much money or that. Like, you literally are I just want them to feel content. Like, that's what I've always said to my brother. I just pray that he has peace in his soul, that he, like, I remember getting messages during periods of recovery where he was like, I'm sitting, watching the sunrise, drinking a hot cup of coffee, and it feels so good. And like, that's all I wish for him at this point, is just to feel at peace. And it's so simple, but when you see someone suffer in the grips of addiction, there's no peace.
Yeah, I feel the same way. I just want him to have a peaceful, tranquil life and enjoy life. Yeah.
Kira, is there any final thoughts before we move into gratitudes?
Yeah, like this is quite an emotional conversation, and rather than share the ins and outs of the journey, I can just relate to what Lisa is saying, because to watch your loved one just sit in that loneliness without connection is just, it's so hard, because without those connections, life it's going to be tough, right? And I just, that's what the community of AARC provides, and the way the model is built, and that unique component of the recovery homes and connecting with their families. Like, there are so many families invested in success of not only the kids that go through AARC, but the families as well. And just providing that connection on a different level. Like, it's the majority of families coming in, all dealing with a level of loneliness. Most of all the kid,
Absolutely.
but that loneliness, it like we said earlier, those conversations that are not happening, like that vulnerability that's not there, it has to have a place to go in order to set up the family and the client or youth for success. Very, very important pieces of the whole journey.
Yeah. Speaking to the connection, and it's a little bit off topic, but not really. If I could go back, and I guess that's crazy. I'm the only panelist that has been an addict or is an addict, however you want to phrase that. So I don't know if that's ever happened. Right?
Is a person who has suffered a substance use disorder.
Yes. So if I could go back in some weird, crazy universe where it was possible and pick the kind of suffering, hands down, not feeling loved, not feeling lovable, not being connected to people, would be my last choice. I would be homeless, I would be cold, I would be tired, I would be hungry, long before I ever chose to be not connected and not to feel loved. Right? So it's unbelievably, it's the worst suffering I have been through by a long shot, by a very long shot. The other stuff you can fix, right? You can fix, you can go get a bite to eat, you can find a place to stay. But when you don't feel loved, it's a brutal, brutal thing to feel.
And a very, very difficult thing. I hear you, Chris, a very difficult thing as a parent to know that that's how your child is feeling. You can't take that away.
No, you can't.
Treatment.
You can't, right?
You can help, but it's...
Yeah.
Ooh, Chris.
You even got Kira.
Anyway, let's bring this back to where we need to be when we get into those headspaces, and that's my favorite part of the show, and that is the daily gratitudes. Kiara, we'll start with you. What are you grateful for today?
Sure, and I've
no more than two. I'm just kidding. We're joking pre-recorded.
Yeah, and I have thought about this a lot today, and given the context of what we're talking about and how important those small pieces of gratitude are. So I want to recognize two people today. This lady, she reached out to me a number of weeks ago. She's based in Airdrie. And I was connected with her, like I said, a number of weeks ago. She's a mom who has lost her son. And she was organising an Overdose Awareness Day event in Airdrie for today. There's a representation from AARC there, because we were recording this episode. There's so much gratitude for her. She sent me an email, asked me if we would be interested in attending the event, having a booth there. Next thing I get this poster, this digital poster, and on it is, motorcycle rally, all proceeds will be donated to the Alberta Adolescent Recovery Centre. Now, that wasn't even a conversation that happened between her and me. And the gratitude that I felt for that just blew me away. This mom is
Amazing.
dealing with something that no parent should have to deal with, or that there's nothing worse, right, than losing a kid. And that's how she is choosing to spend her time this weekend, is raising awareness about AARC.
Amazing.
I'm beyond grateful for that message. And the second person, and I won't share details, but a second person that I'm very grateful for this week, and since I've really started working at AARC, is a work colleague. I've worked with her for over 18 months now. The director of fund development and events at AARC. She's worked there for 10 years. And, we often say in the business of nonprofits that, recognition doesn't come easy. And I want to recognize this lady because she has given everything to AARC for 10 years. And now she is stepping down from her position. And just personally, I am very, very grateful to her for now I see behind the scenes what it has taken to keep an organisation like AARC, keep the doors open, and the heavy need for fund development and how much organisation and planning goes into the incredible events that AARC hosts on an annual basis. And, for me, having gratitude for her today, I believe represents gratitude for the whole parent community at AARC, because it is not an easy job to keep going at AARC. Like it's an intense environment, and everybody who works there is doing very important work. So I just want to share my gratitude for the team behind the scenes at AARC that have kept the doors open for families like ours who can access that treatment when there's not a lot of hope.
Yeah. It's a great cup of gratitude, Sarah. Tony, what are you grateful for today?
There's a phrase out there at the moment called compassionate intervention. I think that term should be coined by Dr. F. Dean Dawes. I think that man is an incredible man for what he's given the youth and families. And I'm grateful for him entering my life and helping me and my family and all the other families. And I'm grateful for AARC and the community of AARC. And if I can only say something about Dr. Voss, he's the Oscar Schindler to youth addiction.
Wow. It's heavy. Lisa, what are you grateful for today?
I lost somebody that I love dearly to an overdose a few months ago. So Overdose Awareness Day hits differently this year, So I find I'm still in this stage of feeling angry, and days like this, I find it harder to be grateful. But I'm also incredibly grateful that my loved one is still here, recognizing over so many years how highly likely it would be that he wouldn't be with us anymore. So I feel incredibly grateful for that. And Tony, I'm grateful for you. Like, we haven't had a lot of dads come on. Like I said, I can see a lot of parallel in sort of feelings and approaches and, that sort of thing in my own family with my own dad. And I just commend you for coming on and talking and sharing, and because I think that men, dads, brothers, whoever, they're out there suffering just as much as the moms and the sisters. But I think they have a harder time reaching out and a harder time sharing and showing vulnerability and building what they need, probably with other like-minded men, to feel support. And I think the only way that's going to change is for people to do exactly what you're doing by coming on here and, putting your face to this and sort of sharing your story. And so, yeah, I'm grateful that you're here. I feel like we could talk for hours, so maybe you'll have to come on again. But I'm very grateful that you did this.
Thank you.
I'm going to, in the interest of time, I'm going to echo Lisa's gratitude to yourself, Tony. So very rare do we get a father on, and so very powerful. And like I said, mid-episode. The more I listen to you talk, the more I admire you. So thank you.
Thank you.
Thank you for what you're doing, what you've been through, and what you're going to continue to do in your life. I think it's amazing. Another gratitude I have for today is, I've said this before, but the partnerships I have with AARC, with FAR, with Yatra, like the financial sponsorship of the show. And this is not about money, folks. This is not about money at all. However, I was thinking about it as I was driving along, in that I am able to do the thing I am most passionate about because of those partnerships. And, you know, I had to move to Thailand so I could afford to do it full time. But I can do it full time. And if you love what you do, you've won, right? And I can only do that because of those partnerships. And I am so very, very grateful for that. And as I think about it on days like today, Overdose Awareness Day, and just, I get to do this. I get to help bring awareness to something that I care so much about. And so thank you. And I'll say to you, Kira, but to all of our sponsors, right? It's an amazing thing. I'm also grateful to every single person who continues to like, watch, comment, share, talk about, listen, whatever. Hit all the buttons down at the bottom. So every time you do these things, you're getting me a little bit closer to living my best life. And my best life is to continue making humble living, spreading the message. And the message is this: if you're in active addiction right now, today could be the day. Today could be the day that you start a lifelong journey. Reach out to a friend, reach out to a family member, call into detox, go to a meeting, pray, go to church. I don't care. Do whatever it is you have to do to get that journey started, because it is so much better than the alternative. If you have a loved one who's suffering in addiction right now, you've just taken the time to listen to this incredible conversation. If you just take one more minute out of your day and message that person, let them know they are loved. Use the words,
"You are love.
You are love."
that little glimmer of hope just might be the thing that brings them back.